So the next skill we're going to do, we're going to combine getting a pulse rate and a respiration. This is a skill that a lot of the students get really confused about. I want you to keep in mind it's important for us to tell them that prior to them documenting any results that they get, they need to make sure they say wash hands. Now, when doing the pulse, they should make sure that they count for complete minutes. So the supplies that they need, there will be a watch, and if you could get the clock here that's on the wall, they can either use a clock or they should come to their test site with a second-hand watch. Okay, now when teaching them about getting a pulse and respiration, we teach them separately, but for the testing they need to be able to do this all together. To get the best respiration, it's better to have the patient not even know when you're counting their respirations, okay? So that's something you can teach them. But let's go ahead and I'll start with beginning procedures and we'll combine the two together, all right? Hi, Mr. Thurston.
Yes.
I'm going to provide privacy. Hi, I'm Carolyn. I'm going to be your CNA today, and I'm here to get your pulse and your respirations. Okay? So I would have washed my hands already, so my hands are washed. I'm going to utilize the clock. And one thing that I want you to realize is that the student will be on one side, you as the instructor or the evaluators will be on the other side. Help our students to realize, and when you're testing them to make sure they get it right, have them, it's best if the client is lying in the bed and the evaluator will have their arm under the sheet because they're trying to see where the student places their hand. Okay, so that's a key point when they're doing the pulse as well as the blood pressure. So the student will, of course, have the patient bring their arm on the outside, but the evaluator will have the sheet covered so that the student is not aware of where they're placing their hand. So the first thing I'm going to do is I need to find the radial pulse. So we need to look here, and they should be going along the inner aspect. And let's see if I get that pulse. So I'm going to start my count. And since this is for you instructors, and I know you know how to do it, I'm not going to do it for the full minute. We have to teach our students that. But at the same time, make sure they do that for a minute. Then they could keep their hands positioned and they could start to count the respirations and not allowing the client or patient to know that they're doing that. So once we get our reading, then the next step would be, thank you, Mr. Thurston. I was able to get that. I'm now going to wash my hands, and then I'm going to go ahead. And again, here's our sheet. They will have the opportunity to come here. They do not have to fill out any of this information. They just put their results here. So if they got something with the respirations, they can write in respirations and put the number here. The pulse down here, they can put what the pulse reading was. Okay, so let's do blood pressure. And this can be a separate skill that they can get, but we're just going to include everything in one. The evaluator and you as teachers should be after students are getting more comfortable to make sure that they're getting things right. You all are aware that we do have teaching stethoscopes here, and we ask you to definitely check these out and make sure. Now, they're always available in the lab because we want to make sure students are on the right process, right? So for the blood pressure skill, your students will need to have a blood pressure cuff. They will get a teaching stethoscope. Even on the day of testing, they also have to make sure that they have, they actually have the wipes here for wiping the ears. And I would suggest that we teach them to have 3 of these available, 3 wipes. And what they're going to do is they have to show that they wipe the earpieces for each one of these. So for the red, I'm going to wipe. Then I'm going to come and wipe the earpieces for the black ones here. And the last piece, they have to make sure that they wipe, and they could not pass if they do not wipe the bell, which is here. Okay, so we have wiped all pieces, and Mr. Thurston, I am ready to get started with you. So we're going to use, again, Mr. Thurston, your arm. The key thing they want to see is, do your students know where the palm should be up, where to feel for the brachial pulse. They're going to be looking to see that they're feeling in the right place. Now, if our candidates do not feel anything, we should teach them not to get alarmed, right? Then they should actually, we're going to have to start over with the blood pressure piece. How can you